Why chemotherapy happens in cycles? This is the most common question asked by the patients and their attendants. If chemotherapy is working and acting on the cancer, why can't give it continuously? Why we need to give breaks in between the chemotherapy cycles? I am Dr. Ravi Krishna Madala, Consultant Medical and Hemato Oncologist, working with Speciality Cancer Care. Let us understand how chemotherapy works. Everyone thinks like chemotherapy is a bomb which will kill all cancer cells at once, which is not true. Let's take an analogy how chemotherapy works. Imagine a city filled with the mosquitoes. So we have to spray insecticides at the night. It will kill majority of the mosquitoes, but some will survive because some might not be active, some might be hiding, or some might be inherent to the chemical. So the same analogy applies to the chemotherapy also with respect to the cancer cells. At any point of time, the chemotherapy cannot kill all cancer cells because some might not be dividing, some might be hiding in places where the chemotherapy cannot reach. Some cancer cells might be inherently resistant to the chemotherapy. So that's why we need to repeat the chemotherapy cycles. The next question is, so if we want to give the repeated sessions, why not we give it continuously? Why we need to give a breaks in between the cycle? That is the next common question. So we need to understand chemotherapy acts not only on the cancer cells, but it also acts on the normally dividing normal cells like bone marrow cells, hair follicles, mucosal lining of the mouth and intestine. So if you don't give break, so body will not have sufficient time to recover. So after every chemotherapy, body needs time to recover. So during this phase, the cells counts will improve, the immunity will improve, and the tissues will heal. So that is why we need to give gap between chemotherapy cycles for the body to recover. So we understood why we need to give gap between the chemotherapy cycle because it allows the body to recover the normal cells. But the next question would be, what will happen to the cancer cell during this recovery phase? So will that not grow is the common question asked by the attendants. Yes, the cancer cells also will grow during that period. That's why timing is very important. So what happens with the chemotherapy was, after chemotherapy, the majority of the rapidly dividing cells will be killed, and some cells which are hiding will be surviving. So during this recovery phase, the surviving cells will start dividing again. So if you remember, the cancer chemotherapy acts majority on the rapidly dividing cells. So the resting cells which are dividing now can be attacked by the chemotherapy. So that's why timing is very crucial in the cancer chemotherapy. So if you give longer breaks, it will allow the cancer cells to grow. If you give shorter breaks, it will not allow the body to repair. So timing is very important. That's why many oncologists are more worried about maintaining the schedules. So we cannot delay the chemotherapy and we cannot reduce the chemotherapy duration also. Timing is very critical. So it is about balancing the killing the cancer cells and maintaining the normal body functions. So in short, why we need chemotherapy in cycles was because chemotherapy cannot kill all cancer cells at once. Normal cells need time to recover, and timing the chemotherapy improve the cancer cell kill. Next, therapy not only happens in cycles, it also happens in phases. One phase may concentrate on shrinking the tumor, other phase concentrate on removing the tumor with the help of the surgery, and the other phase may concentrate on treating the microscopic disease which is not visible to the eye. So each phase has a purpose, each cycle is planned, nothing is random. If you are undergoing your cancer treatment or unsure why your treatment is structured this way, don't stay confused. Book a consult with us at Speciality Cancer Care because if you understand your treatment, you go through it with confidence.